In this video, we will be discussing the 10 test. The purpose of the 10 test is to provide a quantitative score to an individual's light touch perception. For this test, there is no equipment needed. You use the subject's hands and fingers and your finger. For the setup of the 10 test, the subject should be seated comfortably with their hands supported. A normal body part, finger or hand, is lightly stroked by the examiner's finger, and the patient is told that the feeling in this normal part is equivalent to a 10 on a scale of 1 to 10. 10 is the best sensibility that can be perceived. The examiner then lightly strokes the normal or 10 area while simultaneously and with equal pressure stroking the abnormal area. The patient is asked to rate the test area compared to the normal area on a scale of 1 to 10.
Okay, so I have your hands stabilized here, and we're going to be testing your finger sensibility. This test uses a rating scale from 1 to 10, with 10 being the most normal sensation and 1 being the most abnormal sensation. So first, on your non-impaired hand, I will show you what I'm going to be doing so you know what a 10 feels like. And then I will do it to both fingers at the same time, and you will rate your impaired hand on a scale from 1 to 10 with how normal it feels compared to the normal hand. Okay?
Okay.
So we'll do your ring finger first. This is what a 10 feels like, okay?
Okay.
So now I will do both, and you're going to be rating your right ring finger from a 1 to 10. What would you give that a rating of?
Probably a 3.
Okay. Now I will show you the pinky finger. This is what a 10 would feel like. And now I'll have you rate your right hand.
I'm thinking a 5.
Okay, sounds good. Thank you.
For scoring, the response from the patient rating the sensibility of the test area is recorded as a fraction out of 10, between 1 out of 10 and 10 out of 10. 10 out of 10 equals normal sensory perception. The test may be repeated to produce an average score. The 10 test has been validated in adults and children 5 years and older. To establish test validity, 121 evaluations were carried out by an independent examiner in 49 patients with peripheral nerve disorders. Both the Sims-Weinstein and 10 tests were done in the same areas and in the same patients. The degree of association between the two tests was determined using a Spearman-Rank correlation coefficient for ordinal data. The Spearman correlation was negative 0.71 with a 95% confidence interval equaling negative 0.68 to negative 1.0. indicating a high degree of association between the two tests. Inter-observer reliability was determined by having two observers test the same patients at different times, and a random order of test finger sites was used. The reliability of inter-observer measurements was determined by calculation of an intra-class correlation coefficient with a 95% confidence interval. The intra-class correlation coefficient of 0.91 with a 95% confidence interval of 0.87 and 0.94, allowing the conclusion that there is excellent reliability among the measurements of the examiners that is significant. Here are my references, and thank you for watching.